I've got a 3-finger gap from diastasis recti after 2 pregnancies. Will a mommy makeover help fix that too?
So let's talk about diastasis recti, which is this term or medical term for loosening of the abdominal wall. A long time ago, insurance would cover tummy tucks if you had the right diagnosis or diastasis recti. And so there was a lot of abuse of tummy tucks because patients were going to their family practitioners and looking for referrals with a diagnosis of diastasis recti because they potentially could get their tummy tuck covered by insurance. That game was played a long time ago, like back in the 70s and 80s. Since then, the insurance companies sort of wised up and said no more. And they don't really recognize that as a treatable medical problem for the vast majority of patients. And it's probably appropriate because it was really sort of an abuse of the system that was done a long time ago. But the lore of medicine, and really out with a lot of our referring physicians, that term diastasis recti has been passed on and on and on and on. And patients oftentimes are afraid when they come in, they talk to us, and they present this grave diagnosis to us of diastasis recti. It's like, oh, my doctor said I have diastasis recti. Am I going to live? Or and they're super concerned about it. And really, it's pretty simple. If you have pregnancies, you're going to have a loose wall. You might have a little bit, you might have a lot. Most people are going to have at least some. And so having a loose wall after pregnancies or really a weight loss is an expectation. And so it's not a grave diagnosis. It's nothing to be afraid of. It's literally just a loose wall. And so that's what tummy tucks work on, is tightening that up. And whether you can put 3 fingers or 1 finger or 8 fingers, if it's loose to you, and we can really tighten it up. And so I kind of try to caution patients and try to keep them from being scared about that as if they have some grave diagnosis. Now, interestingly, when you tighten up the abdominal wall, you make the core stronger. And so you can imagine a muscle being something that pulls 2 things together, right? Attached to a couple bones. And when the muscle contracts, the distance shortens and those bones get pulled together. And for your abdomen, ribs to your pelvic bone, it would pull you like in a crunch. Okay, so if your wall is stretched out and your muscle is doing a curve rather than a straight line, and it can contract, as it starts contracting, it really just pulls the muscle straight. And once it's straight, it pulls the 2 bones together. And so you lose a lot of your muscle function by just getting it to the point where it's straight. And then from there, you have whatever's left. And so you really lose a lot of the efficiency of your actual rectus muscles. When you tighten up the wall and sort of realign those muscles, as they contract, they immediately start pulling the bones. And so the same muscle with same strength does a lot more work once we straighten it out. And once it can do more work, it's therefore kind of stronger. And then that helps balance out with your back and provides you a stronger core. And so that's sort of one of the side benefits of having these procedures, is that it can improve your core strength by making your muscles actually work more functionally.